What's unique about cervical cancer is that it's a disease that affects only women. But unlike many other cancers, it affects women at all ages and stages of life. It affects women who are grandmothers, who are mothers, who are working productive members of their society. And so when they get this diagnosis, this has a huge impact on their families, on their communities, and also ultimately on the economic well-being of their countries. Often when we think about how we should be tackling this global problem of cervical cancer, we naturally think to prevention strategies. And specifically, we think about HPV vaccination. And that is a necessary and essential step in global disease control. But it's not the only thing we need. What are we going to do about all of the millions of women who've already been exposed to the HPV virus and for whom vaccination is actually not going to be effective for them? We need advocacy around treatment, and radiotherapy is the standard of care for locally advanced cervical cancer, and it's actually a curative treatment for these women. And we need to be thinking about a comprehensive strategy for disease control for cervical cancer. We need to think about prevention, and we also need to think about treatment and palliation. Many people think that radiotherapy is just too complex and too expensive to be scaled up in low and middle income countries. But actually what this analysis showed is that it is affordable, that by curatively treating women for their cervical cancer, we allow them to return as productive members of their families and of their communities, and they generate billions of dollars in revenue for those communities. I'm Danielle Roden. I'm a radiation oncologist at Princess Margaret Cancer Centre.